Thank you so much, Margaret, for that kind introduction. And also, I literally just defended last month. So like that's the most I've ever been called doctor in my life. And thank you. Thank you. So before we get started, if you will indulge me for a moment, I told my friend that I was presenting at 4 p.m. on a Friday. And she's like, oh, tell me how many people are going to be there. So I'm going to take a little video for her. And I told her, I'm like, it's only going to be the most dedicated people. They're going to be there. And so I'm going to count to 3. And then I would like for you to say, hi, Sadie. Okay. So are you ready? 1, 2, 3. All right. Thank you so much. Love that. But it is actually appropriate to save the court people for last because we are kind of at the end of the process, right? When somebody comes to court, when someone is in front of a judge, a family is in front of a judge, it means that something happened. Somebody got hurt. Somebody lost their house. Somebody is in danger. A kid did something stupid sometimes. But we're really like the end of the road. So it kind of makes sense for me to be last. So in full disclosure, even though I work for the courts, I'm not a lawyer. I actually went to graduate school to be a school counselor. So I'm really more like a lot of you, like you are my people. And it gives me, I'm not going to bother you with the bumpy road that it took me to get to court consulting, but I will say that it does give me a really unique perspective to share with judges about why they should care about things that happen before they get a petition. So a lot of times in juvenile and family court, we hear from judges that that's not my problem. I don't have a petition. I can't get involved in that because they're only thinking about a case, a specific case. And we have to really push them to think in the aggregate and think about their community. And so a lot of the work I do at NCSC is helping juvenile and family judges, and also more recently, criminal judges and other types of judges to think more about their role in prevention and their role as a system player. Is this my clicker? Yeah, okay, thanks. All right, so today I'm going to talk to you about a specific initiative, as Margaret mentioned, called Upstream. Upstream is a judicially led but community-based community mapping and coordination effort. And really our goal with that is to help avoid maltreatment, avoid court involvement, avoid out-of-home placement, but also build communities that are stronger and safer and healthier for families. So I'm going to talk a little bit about the court's role in prevention. Then I'm going to talk about the foundation of our upstream effort, what the process looks like, and kind of what we've learned along the way. And I'll also share some of the resources that we've developed that are available on our website if you want to learn more. So by show of hands, perfect. By show of hands, who either works for a court or has worked on system improvement efforts and partnered with a court? Okay, I see a couple. Okay, good. Yeah, it's really common in my field to talk about system improvement efforts with judges as leaders and conveners. And I often hear people talk about things like, oh, if you have a judge call a meeting, then people will come. Sometimes that's true, but sometimes it's not. But I like to think there are actually more important reasons that judges should be involved in prevention. So I'm sure all of you are probably aware of that upstream parable that gets talked about in prevention a lot, right? We're standing next to the river. We see kids coming down the river. We're trying to pull them out. And then somebody gets out and plugs the hole in the bridge. That was my abbreviated version. When I think about courts in that upstream parable, the courts are at the very end of the river. By the time people get to us, they're exhausted. Likely many people have tried to pull them out. Some have been partially successful, even completely successful, and they've fallen back in. Or maybe nobody has tried to help them out in the way that was effective or successful. And sometimes when they get to the court, we're able to build them a bridge and get them out, or we're able to, with someone else's help, do something to help them get out, sometimes we end up making it worse for them. The court cannot solve all these social problems on its own. And we definitely need to be part of these conversations, because judges see what happens when our prevention efforts haven't been successful, if they haven't hit the mark, if we don't have the resources to help families in the way that they have to be helped, if our communities are hurting. Judges see the aftermath of that. So they can kind of look from that perspective and say, here are all the opportunities that we could have done something and we maybe missed the mark. So they have a really valuable voice for being at that table. And when families come to court, whether they're coming to juvenile, dependency, family court, it's often not the first time that somebody has identified that there is something going on, a concern or a need in that family, right? There have likely been other opportunities along that way for them to get help. So I see judges as very crucial to this conversation, and court administrators, because court administrators, not only do they don't see what's in a courtroom, but they have a better vision of what's going on in the community, what resources are available. Oh, sorry, it's my brother. So we like to talk about in Upstream that it's all of our responsibilities to help support families. This brief that I have on the screen right here is an example of one of the resources that are on our website that we wrote to articulate kind of why we think courts are really important to be in the prevention space. And really, our audience here is kind of judges, because we want to encourage them to think beyond their courtroom and think about what the decisions they make every day, the families they see every day, what could we be doing to provide those services outside or before court involvement, if possible. So one of the things that we hope to do, and one of our goals with Upstream, is really to connect some of these disconnected silos and systems. So as I mentioned, families, go through and this just as well as I do, families bounce through all of these different silos, all these different systems on their way to court. We all serve the same families, yet we're very isolated in our purpose, in our role, in our sharing of information. And I don't mean just information on a case, although that is sometimes what we're not sharing, but I also mean information about what we do and information about our purpose and what initiatives we have going on. So I often say that the juvenile court has a PR problem, because I really feel like nobody knows what we do in juvenile court unless you've been in it. And I recently had the opportunity to interview several high school teachers about the juvenile court. We serve the same people, right? Teenagers most of the time. They had never heard of some of the words that we use all the time: collateral consequences, diversion, restorative justice, unless they had a restorative justice program in their school. But we all use different language in these silos, and that contributes to us maybe not understanding or recognizing what each other does and how we all contribute to the systems that we work in. And if we, as professionals who see each other at meetings and maybe work on the same kind of oversight committees, don't fully understand the roles and responsibilities, how do we expect the people that we serve to understand who we are? Many times when I interview parents who have been involved in the child welfare system, they think that the court and the child welfare agency are the same. You're both taking my kid from my home. You both don't want me to succeed, right? The public doesn't see us as different, even though we have very different roles. So part of what we really hope to do in Upstream is to get people from all these systems in a room talking about what they do, what strengths they see in their communities, and what are some opportunities to work better together. So really the foundation for Upstream, and I guess I would also want to say, one of the things that I really put out forward when I talk about Upstream is that we are not wanting to be another initiative. What our goal is to coordinate all the wonderful initiatives that are already happening. We don't want to replicate anything. And you'll see a little bit more about how we do that when I talk about the process. But our goal is really coordination. What I've recognized, at least in my experience in social services and also in working with courts, is that often when we identify a problem, the first thing we want to do is plug that hole. We need to have a task force. We need to have a committee. We need to have an initiative. We need a new program. But sometimes there are other things already happening in that space that we can plug into. And so I'll talk about that in a little bit, but I think that's important for us to keep in mind when we talk about what upstream is. So is anyone familiar with the sequential intercept? Some of you, and we did one in Kentucky not too long ago. So great. So sequential intercept mapping was developed several years ago, but it's used technically in the criminal justice system to identify intercept points where people with mental health or behavioral health needs can be better served outside of the justice system. So without penetrating deeper into the justice system. And so you can see it kind of starts intercept 0, which is like prevention, and then it goes through what are all the steps and what are opportunities along the way. So groups from communities will get together and map out what are the different processes and services that we have available at these different points so that we can try to keep individuals with those needs from moving down our justice system. So we took that sequential intercept mapping model and adapted it for child welfare. And this is what the upstream model looks like. And so you can see it's very different in that it's vertical and not horizontal, but there are other similarities, right? So we start at the top with community, and that's in that community section. So that's what every community needs to thrive. And I'll talk a little bit more about that in a second. And then we go down, and instead of being about just an individual like the SIM is, this upstream model looks at the whole family. So we're not only targeting the individual who is coming to the attention of the court, we're thinking about the whole family. So we then think about families who have certain risk factors. We have ingrained social determinants of health, which I'll talk about in a second, and also risk factors for child maltreatment into our process. So those are the things that we're looking at. We're looking through that lens at communities to identify what opportunities, services, and processes they have. Then we move down to families with allegations. Here, this is allegations of abuse or neglect. And then finally, we look through families with court involvement. And so these would be families who had an allegation of abuse or neglect and then became petitioned and were in the court. And so this is kind of the process that we use. And what you see off to the right are some examples of resources that might be identified in those areas. Not an extensive list by any means, but just some example. We don't have an extensive list for upstream. We don't believe in having one kind of blueprint of what a community should have, because we think every community is unique and they should learn from their own strengths and they know what they need best. So we don't prescribe any kind of certain, like, here are the exact perfect services and opportunities and processes you should have. Instead, which I'll talk about in a minute, through the mapping process, kind of identify what the community does have. So what you see here is kind of like the original upstream that we use when we're mapping child welfare. We have piloted, we're now on our 4th pilot site. So we started with Massachusetts, was our first pilot. It looked totally different then, and they call it the blueprint, not upstream. Then we moved on to Indiana. Then this past year, Kentucky, thank you very much, Kentucky, is one of our pilot sites in Nebraska. And next year, Missouri is going to be our 5th pilot site. So I'll talk a bit about what that means in a second. So as I mentioned, we have really ingrained social determinants of health throughout our mapping process. And those, of course, are like the structures and communities that affect health and quality of life of the people living in those communities. And we know that people who grow up or live or work in communities that don't have social determinants of health have worse health and quality of life outcomes. There's actually quite a bit of overlap between social determinants of health and risk factors for childhood maltreatment. So if you look at things like poverty, limited employment and education options, food insecurity, home or community violence, those are all things that are also risk factors for child maltreatment and reflective of social determinants of health. So through our mapping process, we use the social determinants of health as a framework to help people think about what are the resources in their community, as well as what are the opportunities. And you can see here these protective factors for child maltreatment. If you just look through some of them, you can see how they really do overlap with a lot of the social determinants of health. So, all right, now let me get to actually like, what am I talking about when I say upstream? One of the things that that I always get questions about is like, how does the upstream process differ from like community mapping, right? Or resource mapping. So when somebody, an organization or agency chooses to do resource mapping, sometimes courts do resource mapping. They're really looking from their own perspective. What resources do we have available to us, period, and give me a nice directory. When we talk about mapping and upstream, we not only look at what resources, but we also look at the process, and we look at, are those resources being used efficiently, effectively, at all? Where are the gaps, not just in terms of services being provided, but where are the gaps in terms of access to services? So one of the things that we do at the beginning or preparing for a mapping workshop is to actually go and ask communities to give us all the resource mapping that they've done. If they have a directory, if they have United Way, or if they have, 211, and they've collected, or an agency has collected their resources together, we will collect them all together, and we will use that to start our map. Where we really have been, where Kentucky has really been helpful to us is that this is the first state that we were doing statewide mapping. So we previously only did local mapping, but here, Kentucky is at AOC has the Judicial Task Force on Behavioral Health, and they've been so supportive and wonderful with us that we have completed a virtual juvenile justice mapping, and we have completed an in-person child welfare mapping, which means that we have leaders from all the state agencies. We also have representatives from local communities. We have judges. We have individuals with lived experience in the system who have all come together and looked through and talked at the state level. What policies do we have in place? What are some of what are some of the gaps that we have in policy? What are some of the policies that we have that keep people from being successful or keep people from being able to access services? And so we have really been, Kentucky has been so helpful to us in terms of really helping us design what those statewide mappings look like. And actually, with encouragement from Kentucky and Nebraska, is why we are adding juvenile justice to our upstream mapping, because we realize that those first two levels, community and families with risk factors, are the same, regardless of what process that you're in. So thank you, Kentucky and Nebraska, for doubling my work, but also helping me to think through this in a way that I think is going to be more useful to communities. So I'm really excited about that. Anyway, so we start with state leadership planning, and that is really getting people together with 4 kind of primary purposes. Number 1, coordinate. Like I said, we don't want to replicate the wheel, and so many states and communities have exciting initiatives and efforts going on. So like here in Kentucky, they're Thriving Family, Safer Children State. We were able to take so much of the work that they've already done in that initiative and use it to help us get a map started for upstream. So we will spend a lot of time at the state level with state leaders saying, what are the things that are important to your state? What are the priorities and policy that you want us to know about? How can we coordinate all these things? The other 3 things we do is identify partners. We always want to identify partners who can kind of run the gamut of not just the kind of what I call usual suspects who might be at every child welfare or JJ meeting, but we also want to expand that. So we had someone from the Department of Transportation at our upstream mapping in Kentucky for child welfare, which was really exciting because he was able to talk through what are some of the things that the Department of Transportation can do to help increase access to services. In another state, we invited someone from the Department of Labor who is able to say, hey, I have a whole bunch of funding for this one population. How can you guys use any of it? Right? So sometimes it's just getting right people in the room at the right time to be able to say, here's how we can share and leverage resources. So coordination, partners, policy, and then fourth is really planning how it's going to roll out. So every state has done this a little bit differently. But essentially, as I mentioned, Kentucky is the first one where we're doing statewide mapping. In Nebraska, we're not doing statewide mapping, but we are training facilitators who will go out and do a series of regional mappings. The other two options are in Massachusetts. They actually have a public health professional who's employed by the Administrative Office of the Court. That is the only AOC that I know that has a public health person, and she's wonderful. And her job is to do STEM mapping and upstream mapping across that entire state. And so they are kind of doing it that way. And Indiana has attached it to their JDAI initiative. So they're using the JDAI groups in different regions in Indiana for their upstream group. So every state that we worked in has done it a little bit differently. But really, that statewide mapping part or that statewide planning part is really to get us primed and ready to build motivation and to make sure that there's a plan for going forward. Because just like, this is my favorite joke. So if you've ever heard me talk before, you've heard me say this, but just like after a wedding comes a marriage, after a mapping comes an action plan. So that statewide planning committee has to know right after, has to be sure who's going to carry this action plan to fruition. Every mapping is 1.5 days at least, and the whole second day is really spent action planning. And so we want to walk away with an idea of who in that state is going to be responsible for that action plan. So then I mentioned in some of our states, we are doing facilitator training. So we have a train the facilitator 2-day workshop that we do. And sometimes and we've trained 30 people in Indiana, 8 people in Nebraska. We'll be doing a training in Kentucky in the spring. And really the point of that, or our goal there, is to build states' capacity to be able to continue the upstream process. And then finally, we get to local planning, which is my very favorite part of upstream. And that's really getting into a community and identifying and having them tell me, what are their strengths? What are opportunities they see? How can they share information? How can they leverage resources? And the cool thing about that is that I've been in many of these local mappings, and we'll get people all in the room, and they're people that might see each other all the time at meetings or talk about, or, have serve similar families. And they're always learning about new resources or new processes or new things in upstream mapping. So one of my favorite parts of upstream mapping is just to hear that conversation, because all of us are so busy with our jobs. Sometimes we don't get the chance to just sit down and hear what other people are working on. So we usually take about 4 to 6 months to plan for just one local mapping. And that planning consists of focus groups with people within the community, gathering any kind of local resource directories or strategic plans. Some counties have a lot of plans. They're working a lot of different things. And we try to gather all that together so that we are, again, not replicating the wheel, and that we're going into these mappings with an idea of what's already happening within that jurisdiction. And again, our goal here in identifying the gaps or the opportunities within a community is not to fill it with a program. We try to really not, when we have the activity part of the mapping and we ask people to document opportunities, we try to steer away from only looking at programming as an opportunity, because there could be also other things like housing or food insecurity, or maybe there needs to be more communication. So we're not always the answer is not always coming from a program. And that's something that's important to us to kind of, and why we think about the social determinants of health, because we want to make sure that we're growing a stronger community for everyone. And yeah, so that mapping, when we're finished, we provide the community with a report that includes the map of their community, as well as the action plans that they generate at the mapping workshop, and some recommendations. And this is just an image of what a map might look like. So you see it looks like our generic upstream model, but you can kind of see some of the smaller boxes that are the process boxes that go through families with risk factors, families with allegations and families with court involvement. Another thing that's really neat, that I think is really neat about the mapping workshop, is that we always start on day one with having people from court, child welfare agency talk about what their process is. Because even though sometimes organizations work with families that are in those systems, they may not always understand what the process is. When do we call the hotline? Do we have an option besides calling the hotline? Right? If that's a question we get from doctors a lot. What can we do if we don't want to call the hotline, or we don't feel like this rises to the level of calling the hotline, but we're concerned for this family? Who else can we turn to? So those are the kind of conversations that we have through the mapping workshop. And again, like every mapping workshop looks different. Well, we have a general framework, but what comes out of that is really individualized to the local community. And this is just one example. This is one of the earlier maps that we did in Hampden County, Massachusetts. So I said theirs looks a little bit different. They call it the blueprint, not upstream. But you can see, well, I don't know if you can see because those words are very small. But at the very top, it is what we originally did when we adapted SIM to child welfare. We changed the names to primary prevention, intervention, court involvement, like we talked about the system and not the families in it. And that was been one of our greatest lessons through upstream. So I guess we started upstream in 2019. And over the course of the last 4 years, I think one of our greatest improvements to the process was recognizing that we're not talking about just changing a system. What we're talking about is families and how can we support families. And I think that messaging has been really helpful in talking to judges, because so often judges are thinking about their cases. We think about cases like that's not just a case, that's a family, right? That kid is not a kid, he's part of a family. So we're trying to really encourage judges and judicial leadership to think more holistically about the individuals that they serve. And so that's one of the kind of real intentional changes we made with our upstream models to refer to families in that way. So Kentucky, I kind of have talked about them a lot, but I just want to mention a couple more things. The Judicial Commission on Mental Health, again, I just wanted to give a shout out to them because they've been super supportive of us. And we have completed a statewide sequential intercept mapping for the criminal justice system, and that should be out and available to the public. Again, we piloted our virtual juvenile justice one, and we're working on that report, and we did a child welfare one. And of course, those two will now always be done together. The facilitator training for Kentucky will occur later next spring, and then we'll start doing local mappings from there. So I wanted to talk just briefly about some of the other things that we've learned through this process. And we have created these briefs that are available on our website to kind of address some of the things that have come up as we've started to do these mappings. So number one, the benefits of upstream for child welfare agencies. One of the things that we learned early on in the upstream process is how beneficial it is to bring in partners from the beginning. In some of the states that we worked in, we hear a lot of, oh, we're already doing that. We already have something like that. And it has been really helpful for us to make sure that we have child welfare agency buy-in and partnership from the get-go, because we say this is judicially led because we need to have a judicial champion, but really it's community led, and it's all of us are responsible for this. So really bringing in child welfare agencies from the beginning has been one of the greatest kind of lessons that we've learned. And that certainly have been very supportive in Kentucky in our work. But we often suggest that our judges and our court administrators share this brief with their child welfare agency if they're interested in learning more about upstream. Second is about using data to map community resources. On day one of one of our community mappings, we do share data. So part of our preparation for a local mapping is collecting existing data that the community agencies already have. And we will have them present a little bit at the beginning to the rest of the group. We feel like this is important because it helps them to have a conversation about what's important to them. what are the data, what are their performance measures, what are their indicators, and then it also gives the whole room an opportunity to have the same understanding of how the system is currently functioning from some different perspectives. So we have this brief that we use online to kind of go through what are some of the data points that we think are important to this effort. And we also recognize and talk about this at the upstream mapping that data doesn't tell the whole story, right? There are stories of family members, there are stories of children that you can't see when you're just looking at the numbers. And while it doesn't tell the whole story, it does kind of help communicate and give everyone a level understanding of how things are happening or performing in the jurisdiction. And because it doesn't tell the whole story, we think it's so important for us to look at that data from an equity lens too. So we make sure that we talk about the importance of looking at data disaggregated by race and by neighborhood, because when we're talking about social determinants of health, we know that that changes from neighborhood to neighborhood. And that's what, at the state level, it's really hard to think about that because we can show averages for the whole state. But when you dive down into a local community and you see how that looks in the community, that's where you can start to recognize those resources needs and those opportunities. So we really try to make sure that data is presented and we have those conversations about why some areas maybe have different resources or different ability to access resources. So we try to really build that in and have it part of all of our conversations, not just the data conversation. And finally, we also really value including individuals with lived experience at the table. And this is something that NCSC is actually working on courts to do in a variety of ways. And it's not always easy. I think it's a learning curve, both for the individuals that we're asking to come and join us in improvement efforts, but it's also a learning opportunity for court professionals. We have learned that we need to prepare court professionals just as much as we prepare individuals with lived experience so that that can be meaningful for both individuals. So we've really encouraged the inclusion of people with experience, both good experience and not so good experience with the system, to come to our mappings, and that has been very valuable. So this brief is just like the tip of the iceberg on how to try to make that happen in a way that's meaningful for everyone. So that's my whole message about upstream. We are currently, as I mentioned, working a lot in Kentucky and Nebraska, and next year we'll be working a lot in Missouri. We keep calling it a pilot every year. I think our funders like, when is this not going to be a pilot anymore? But we learn so much every time we do it. Just like I said, in Kentucky, they allowed us to try to do a statewide version, which has been really exciting and really cool. And so now we're kind of in the process of standardizing that so we can do that in other states. And every single local mapping that I go to, I learn something new, or I think of something that we should have done better or different. So we keep evolving and making improvements to this, but I'm really excited because this is a framework that I can use with judges and talk to them about the importance of being involved in prevention efforts. And it really start to build some connections between the courts and community members. Every year, NCSC does a survey of the public's perception of courts. And it's really sad when you look at it as a court person, because public perception in the courts has been going down, 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 down. We also have a question on that survey about, are courts fair and equitable to everyone? And that has been decreasing and decreasing and decreasing. So I think I know so many judges who work so hard at making trauma-informed courtrooms or trying to partner with schools and working on restorative justice programs. I just want them to be able to outreach more to their communities and talk about some of the good work they're doing, not just to improve the public's perception, but also to help improve lives and environments for families and children. So I'm really excited about upstream. I think there's a lot of potential there. And I just want to leave you with kind of inviting you to please invite courts, invite judges, invite administrators to join your system improvement efforts. Let them hear about all the good work you're doing. I heard about so much cool and good work while I was here today. And so let them hear about what you're doing and listen to the things that they're working on. We have a lot of courts working on improving their responses to behavioral health, improving the way that they have trauma-informed hearings. And so I think that you'll find a lot of similarities between some of the ways that you're trying to serve the public and that they're trying to serve the public. So I will just leave you with that kind of request. Please invite them. And if you do reach out to your judge and they tell you that they're not working on anything to be more trauma-informed, send them to me. Okay? So, I guess I talked quickly, so I do have a couple minutes if anyone has any questions. Well, if your question is so good and juicy that you don't want to ask it out loud, you can always email me. Oh, I should mention that QR code there is how you can get right to all of our upstream resources. So, well, thank you very much for your time and for being here at 4 on a Friday. Thank you.